I'm sitting here currently in one of our flagship hospitals for Adventist Healthcare. I'm in Shady Grove Hospital Medical Center right now. And I have to say to you that based on rounding and speaking to our physicians and knowing our census, which we keep a very close eye on across our hospital system, we are busy. We are busy. And I think there's a disconnect a bit between when I go out into the public, when I go home and I'm in Montgomery County or Arundel County or down in DC or Baltimore, a little bit disconnect about how people perceive COVID a bit. People are often maskless. People are often very close to each other and, not really cognizant of the importance of keeping boosters up to date, for instance. And I will say that, for instance, in across Adventist Healthcare, we're managing, but our workforce is very tired. When we speak of COVID right now, we're very blessed to have the alternative care site at Tacoma Park, which Adventist Healthcare runs, but it's run for the state, of course, to relieve some of the burden for hospitals regarding COVID patients. 2 weeks ago, their census there was 60 or so. It's 90 now. And so COVID is very, very real. It is very, very still much out there. We are seeing that a lot of our patients, especially the ones who are particularly ill on breathing apparatus or vented, they are majority-wise, if not completely, those who are unvaccinated. And so I know that there is vaccine fatigue amongst those out in the community. I myself do not like or enjoy getting shots, but it is very important to keep up with those boosters to keep yourself healthy. And it's not only about oneself being healthy. We all are in contact with people who are elderly or cancer patients or otherwise immune compromised. And so for the community benefit, it is a citizen obligation, I believe, at the highest level to make sure that your vaccinations are up to date so we can continue to protect the community. At Adventist Healthcare and across, when I speak to my colleagues who are chief medical officers at other institutions, such across at Holy Cross or down at the hospital center in MedStar, we are concerned about COVID and the flu. RSV has started to take a bit of a downturn, so there's a little bit of relief there. But as far as respiratory viruses, there is a burden in our hospitals right now that keep all of our healthcare workers on alert and working hard on your behalf and on behalf of the community. And I want to remind folks that one of the effects of the pandemic has been that folks have delayed their healthcare, which means that in your acute care hospitals right now, not only are we battling the respiratory virus, but we have other patients who do not have COVID who are extremely ill. The acuity of the patients that we have on our inpatient units that are packed right now with both virus and non-virus folks is keeping everyone really working at the top of their license, at the top of their abilities. So operationally in our hospitals, COVID is still very real. The effects of the pandemic on other illnesses because of delays is very real. And then we deal with, of course, our workforce issues, which were referred to just moments ago. Our workforce in healthcare, everyone who's working right now wants to be there. If they did not want to be there, as has been the cases we've seen over the last 2 years, they have sought other ways to employ themselves or to be employed. And so when you're in the hospital, you're looking up into the face of a new nurse or a doctor, all of them are wanting to be there and serve our community, but they are tired. Across the United States right now, burnout for physicians is at 56%, a little bit better than that at Adventist Healthcare, but believe you me, there has never been a time in my 26 years of being a doctor of having it be quite this difficult to take care of human beings. Resources are low, work staff are low, and we are having to be ever innovative in how we take care of people. Healthcare in particularly is not built to not have human beings take care of human beings. And so when one is ill, it's not just technology, which we have plenty of, but it takes a human being to hold a hand, to explain things to folks, to be sure that things are interpreted properly, communicate to consultants, to other doctors, to nursing staff, to CNAs and other ancillary staff in hospitals. It is definitely a village of care that it takes, and there is no way around not having human beings to do it. So we are stressed as far as workforce is concerned. we've worked very hard to make sure that folks are taken care of so that they can have time off, so they can have time off stage. But even so, with the acuity of patients, it's very, very difficult right now in our hospitals. And so also to the commentary about being wise about how we choose to go to our emergency department, you'll get taken care of. No matter what you come for, you will get taken care of. But there will be a delay if you are not as sick as someone who may be ahead of you. Okay. So our elderly folks, our other infirm, our folks with acute problems that affect their breathing, their heart, those folks are going to take precedence over other issues. Doesn't mean you shouldn't come to the hospital, but if you have an outside primary care doctor you can call and come into the next day, sometimes urgent care is a choice as well. It's just very important to be prudent about how we go forward here. So I'll just say in summary and leave room for others to speak and for questions to occur. You know, your healthcare workers, your hospitals, your hospital administrators, your doctors, your nurses, people who greet you at the door, registration, everybody in healthcare right now is stressed and working very, very hard. It's not like we can't do it. It's not like we have a calling and a way about us that means that we're going to meet whatever challenge that comes forward. But it would be an understatement to say that we don't need your help. We do need folks to continue to get vaccinated. We do need folks that they're going to be in a large crowd, particularly a family who have elderly or folks who are immunocompromised. Please go to your local drugstore, get a COVID test, and do that before you're all in each other's faces in a warm space when it's cold outside. And really, really consider masking when you're inside of a building with a lot of people around, because it's not just you we have to worry about. It is evidently those who are not vaccinated, those who are immunocompromised, those who are elderly and otherwise at high risk is what I would say. So that's my summary statement about how things are going in our hospitals, our workforce. Respiratory virus is not gone anywhere. It's still definitely there. It's important to get vaccinated. It's important to think carefully as you go into our emergency departments, not overstress the overstressed already.